Hello, welcome everybody to Revive Health's Daily Briefing Live for Tuesday, May 5th, 2020. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with COVID-19. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health and your host for the show. I am joined by Chase Kleckner, who is Senior Marketing Manager at Revive Health and our show's producer. Hey, Chase.
Hey, Chris. Good to see you again.
You too. Welcome back. Today, we're joined also by Reagan McFarland, who is a multimedia journalist here at Revive Health. Reagan is responsible for creating various types of digital assets, including short films, imagery, typography, animations, and copy. She creates concepts for digital and social-first marketing story ideas and believes in the power of good storytelling and its role in content marketing. Hello, Reagan.
Hello. Thanks for having me.
Yeah, thanks so much for joining us. I'm looking forward to diving in with you here in just a little bit. As with each show, we're going to cover the latest news on COVID-19 and how it relates to marketing communications, highlight helpful resources, and share what we're seeing and hearing across the industry. We want to make this an interactive session as much as possible, so we are open to questions. If you have a question for myself or Reagan or Chase, please put that in the Zoom Q&A queue at the bottom of your window. You can also use the chat function in Zoom if you want to talk to other attendees, and Chase will be using that to share links of things we're covering. But if you want us to cover a question, make sure it ends up in that Q&A queue. Remember, you can subscribe to this as a podcast on iTunes, search for Revive Health Daily Briefing Live. And as always, we post a video recording of the show by the end of the day. You can find that at thinkrevivehealth.com/COVID-19. And we have other content there as well, which I'll touch on in a bit. Couple of important notes. We are not experts on COVID-19, so not a place to come for medical or scientific advice. We will have advice and opinions on marketing and communications. But obviously, every situation is different, every market's different, every organization is different. So make sure you keep all of that in context of what we're saying so you can make the best decisions for yourself. All right, so we always start these podcasts with the news, and we always start the news with an update on where we're at, which is kind of an interesting story by itself. We could probably have a whole podcast on where are we at, because there's kind of two narratives going. There is the we're moving forward, we're opening back up slowly but surely narrative. And there is the here's what's actually happening with the virus narrative. And they don't always align, as we know. But we'll save that for a different podcast maybe. But we want to know what the case count is because it helps us keep all the things we talk about and think about in context as we continue to move through this. We are hopefully peaking / plateauing, and we'll start seeing a downturn in things like cases and deaths in this country. Though if you saw the news yesterday, the CDC has issued some reports that tell us that that may actually not be coming as soon as we'd like, and that we might actually be going the wrong way, continuing our steep climb. So we'll definitely got to keep an eye on that. We use the Johns Hopkins University tool. And when I refresh that globally, first, we see 3,610,006 cases and 253,381 deaths. We look at the United States. We are now at 1,181,885 cases and 69,079 deaths. So we're going to pass likely 70,000 today. We were on pace roughly about 2,000 deaths per day. We started going down a little bit. Now we're seeing that revised back up. And again, that CDC report predicting potentially by the end of June, 3,000 deaths per day, which would be a 50% increase from where we were in our quote unquote peak in April. So hopefully that is not the case. Hopefully we are not making this worse on ourselves in that way. But again, that's a conversation for a different podcast. So another news story we wanted to share today was an article actually sent to me by my good friend and colleague, Tom Tyner. Give a shout out to Tom at Turbine Labs for sending this in. But this is from Washington Post, and it actually came out yesterday. And it just, once again, we're seeing these stories everywhere. But I thought the language that was used in this story really actually painted an appropriate picture. So the headline says, historic financial decline hits doctors, dentists, and hospitals despite COVID-19 threatening the overall economy. So first, the story says this. This is how it leads off. Even as the coronavirus pandemic draws attention and resources to the nation's doctors and hospitals, the healthcare industry is suffering a historic collapse in business that is emerging as one of the most powerful forces hurting the U.S. economy and a threat to a potential recovery. So it's talking about what we've been talking about for a while now, and not news to anybody, the financial devastation that hospitals and health systems have experienced due to closing down elective procedures to focus on COVID-19. And what the story is doing is tying that to how that's impacting the economy as a whole, because the healthcare industry is the largest industry, the largest sector in the economy. So if it is suffering significantly, the economy overall is suffering. That includes everything from unemployment to GDP. There's just a lot of different statistics in here that are very scary, both for us as a country, but also for our industry. And there's, Vivian Ho, who is a health economist and professor at Rice University, is quoted in here saying, I'm seeing multiple health systems reporting revenue losses that are 50% or more. That certainly lines up with what we know. The story also references my provider, which is Health Partners. I actually am in the Twin Cities, and my provider is actually Park Nicollet, but is part of Health Partners. And it talks about how they've gone from 0 to 70,000 telemedicine visits in 1 month, which is a good thing, but also has seen furloughs of up to 20% because of the financial devastation that they are experiencing. And I can tell you personally how this is impacting me, because I was scheduled to have a screening that's, I think, pretty important. And that was supposed to be in late March. That got postponed to May 11th, which is this coming Monday. I got a call last week saying, sorry, can't see you May 11th. That's now been canceled. If you want to reschedule, call us or schedule a virtual visit. So that just shows you the pressure that these folks are under, because they're still not able to do what they need to do. Our governor actually just announced, I think this morning, that he would be allowing reopening. So that wasn't even possible. But there's a lot of things we could unpack there. We don't need to dig too much into it. I don't want to pick on my provider, but I would have preferred they called me and said, we can't see you on May 11th, so we have rescheduled you for X. They were apologetic in the voicemail, but they put the burden right back on me. And this is something we've been talking about in terms of, if you're going to get back up to speed with your patients, with your procedures, with your volumes, you're going to have to go further than you've gone in the past in terms of patient retention. And just calling and leaving a voicemail for a patient saying, sorry, can't see you, give us a call, is probably not the way to handle it. I think it's a fair way to put it. I will call them back today after we're done this podcast. It's on my agenda. I will report back how that goes. I hope it goes well, because I really need the screening. I think I kind of need the screening. I've talked to a couple of people who said, yeah, you should not wait on that. So I need this. This isn't elective really, but can't get in. And that's not their fault. I know that they're restricted. So important story. Chase, you have shared the link. Is that correct?
That's correct. It's in the chat.
All right. Let's see. One more quick thing, and then we're going to pull Reagan in. Remember our COVID-19 communications hub. That's at thinkrevivehealth.com/COVID-19. If you just go to our website, we have a banner at the top, Chase, that directs them there still.
Yep. Yeah, okay. After the show. It'll be up
after
there.
The show. Oh, we haven't changed that. Okay, sorry. If you go there now, it's just going to point you to the show. The banner will. But you're on the show. Yeah.
That's right.
But what you're going to find there is our latest research reports. You're going to find the content from our biweekly roundups that we send twice a week. You're going to find a lot of information on rapid recovery and how to think about that. So we continue to add content there because there's such a need to figure out how we're moving forward. So with all that said, Reagan, are you ready to go?
I'm ready.
All right, cool. So you're here to talk about video content, just in general, and also tied to COVID-19 crisis. So let's just kind of start broad. Why don't you kind of talk a little bit about how you think about video marketing, how we use it, why it's important, that kind of thing, and then we'll dive in deeper.
Yeah, for sure. I like to think video marketing, video and marketing together is kind of just like peanut butter and jelly. I think that it's one of the most effective, just like elements in digital marketing nowadays, with good reason. I mean, we are spending so much time of our lives watching video, whether that's streaming or on social media, whatever it may be. But I think one thing about video that's so important is that it's super engaging and more memorable, I think. And it's just super popular. And I think, maybe 5-10 years ago, video was kind of known as like nice fluff to have in marketing. But now I just think it's like a necessity when it comes to marketing, and especially right now. And there's actually this stat where it talks about just including video on a landing page can boost your conversion rate by 80%, which is nuts. But before we get started, I actually wanted to ask y'all a couple questions and see how much you.
Can we have the audience join us on this?
Yeah, I would love
so
that.
if you want to post answers, because Ray's going to quiz Chase and I, you put them in the chat, and we'll try to keep up with the answers that come in there.
I would love that. That's so great.
Okay.
All right, y'all ready?
Let's go.
Yes.
And whoever's the winner gets nothing, but
It's your admiration.
We get
your
pride.
admiration.
right.
I won last time, Chris.
You won. Well, I didn't know we were keeping score.
Well, I am.
Okay.
All right, here we go. So, what length in minutes do videos get the most engagement? What length in minutes?
I've got
Go ahead, Chase.
20 plus.
What? 2 minutes.
All right, let me know when you want the answer.
Go ahead. What's the answer?
All right, one of y'all got it right.
Oh.
And it is Chris. It's 2 minutes. Yeah. So
20 minutes?
I think there's a lot of engagement in long video.
Yeah, so it's interesting you say that, Chase, because 2 minutes is actually the sweet spot. But actually, I think it's about 8 or 9 minutes longer is actually another sweet spot as well. So if you're between like 5 and 6 minutes, I think a lot of times people are dropping off early on. So
Can I ask you, unless you're going to get to this, about the generational difference that might have impacted that answer?
Interesting. That's
Because
a really good question.
I think I'm trying to decide whether my approach to video is generational or just me. I actually am not a huge fan of video when I'm trying to consume content, because the reason is it demands commitment. If I'm getting into a 20-minute video, good Lord, Chase, it better be good. Like, we better be talking about like an episode of Ozark, because I am now committing to 20 minutes of not being able to do anything else
That's interesting.
but watching or listening to this video. Whereas an article, I can scan it, I can cut to the end, I can look for the quotes. I can't do that with video very easy. And so, is that a generational thing? Is that just, am I weird in that way, Reagan? What do you attribute that to?
I think that it actually just depends on what the content is. I think if it's a talking head for 20 minutes, people are just going to drop off, versus a documentary style 20-minute video where people would actually be more engaged. So
okay, so setting up expectations maybe for what's to come. All right.
Yeah.
All right. What's next?
All right.
1-0.
What percentage do you think people are watching video on a mobile device? What percentage do you think people are watching video on a mobile device?
Okay, put your answers in the chat if you want to.
So of all video watched, what percentage is mobile? Okay. You want me to go first, Chase?
You go first this time.
Does this include TV?
No.
Too many questions, Chris.
What? Well, I was going to say, if it doesn't include TV, like me watching Ozark on my TV, I'm going to say, like 75%. Somebody put 80% in the.
I'm going to say 67.
All right. Ready?
Yep.
Go for it.
It's 90%. 90%. Yeah.
Oh.
Well, if that is mobile versus like desktop / laptop that I totally believe that. Yeah.
Yeah.
Mm-hmm. It is.
Cool.
Yeah.
All right. How many questions are there, by the way? Can Chase
One more.
Oh, good.
One more.
Game over.
All
Okay,
right.
just for my pride.
So,
going for the sweep.
That's
very
right.
important.
Here we go. Bonus question. Whoever gets this wins it all. No, just kidding. What is the second most popular website next to Google? So Google being number one. What is the second?
Well, I don't know how to do that with my finger. YouTube?
Oh, someone said Facebook.
Yeah.
All right. Yeah, I was going to say Facebook. That's my answer.
All right. And the answer is YouTube. YouTube is the second most popular after Google. Yeah. And I think one reason I want to speak to that, because I'm sure some people are like, what? Like,
Facebook, we should have known. You're here to talk about video.
Right. But hey, video is very, very, very popular on Facebook, and people think that Facebook's going to turn into just one long video feed versus text. But I think one thing about YouTube, that people don't think about is, there's brands that are doing pre-roll before videos and 6-second and 15-second ads, but a lot of people are posting organically, whether you're a brand or an influencer, hobbies. And a lot of times people go to YouTube just to solve a problem, whether that's maybe Chase with your kids. You're like, we need to pull something up right now in this car ride. I'm pulling up YouTube. Or something like my husband and I did this past weekend. Our garbage disposal broke. And before we called anyone, we actually YouTubed it and we fixed it. We just found this guy that had loads of views, and we're like, all right, we're going to click on this one, and we were able to fix it. So I think YouTube is kind of like a Google, but just in video form.
That's also got to be generational. My kids do not watch TV. So my kids are older teenagers. Do not watch TV ever. If we watch TV together, it's because we're watching a movie together that we're streaming. They're spending all their time on Netflix, on their computers, or YouTube. They'll watch YouTube all day. And when they were younger teenagers, YouTube personalities that was it. That was where that was their kind of Taylor Swift and their whatever it was when I was Bon Jovi. That was that age. Whoa. Anyway, okay. So
go ahead.
Go ahead. No, you go ahead.
I was just going to say that it's interesting you say that, because I think a lot of times, people think video marketing is just like a YouTube or a Facebook, but there are so many other outlets like tutorials, webinars, what we're doing right now over Zoom with live video, live streams. It's endless. So
are there other trends you want to talk about that you're seeing now, given the COVID-19 situation we're in?
Yeah, I think one trend I've been seeing, and a lot of people have been seeing, is that you don't really necessarily need crazy equipment and lighting and the whole just setup, especially in a time right now. A lot of people are just using what they have and going on YouTube or Snapchat, or TikTok is really popular right now. Facebook, Instagram Live. You're seeing so many people go live right now, and artists and brands just engaging with their audience. So a big trend is really actually just like social media outlets, and people going on there. And crazy enough, those social platforms are also allowing different tools to make your videos pop. So you can add your filters, you can add your audio, or whatever you need.
Yeah, the TikTok is the recent thing at my household. Chase, are you on TikTok?
Huge.
No, I'm not. I actually got rid of social like a year ago.
Wow.
I guess TikTok is a social media platform, but I don't use it that way.
How do you use it?
I use it just to view the videos. In other words, I don't engage with anybody. I don't have a,
you just watch, you don't produce anything.
Yeah. I don't even have what am I trying to say? Subscription? What's the right thing?
Like a profile or
I don't have,
like
no, I haven't set that up at all. I just watch the videos. So, but I'm also an old, so again, just being honest about that.
Yeah.
All right.
Well, I think one thing too with TikTok is that I even just think about my little brother's on TikTok, and he asks my whole family to get an account so we can see his videos, so there are parents on there that are engaging and looking at their kids or other profiles.
There's a lot of parents on there. As I see most of them are drinking wine, apparently. That is the TikTok thing to do.
Right.
Okay. So, what else you got?
So another trend we're seeing, and we kind of already talked about this, but just how in that quiz that 90% of all video is playing on mobile. So I think mobile video marketing is going to be the new norm. I think that's something that brands need to be thinking about, is just streaming and making things look good on mobile first and then desktop second. I think that's something that's huge. So.
Yeah, and this crisis is, I think, just pushed that even further.
Mm-hmm.
Even though people aren't mobile in the traditional sense, we've talked about this for years, the idea that mobile doesn't mean you're walking around, you're driving around. It means you're using a mobile device. I wonder if someday we'll come up with a different way to kind of frame that. But talk a little bit about how folks can, from a hospital and health system marketing or communication standpoint, leverage video, even just production, because we know there are challenges in trying to produce videos when there's stay-at-home orders, when there's social distancing, those type of things.
Yeah. I think that, and I've kind of touched on this a little bit, but just actively posting on their social media and video and just letting them know that they're there and that they're not being silent. I think that is huge, especially at a time right now. And just, I think one thing as working at Revive is that we've kind of gained a better understanding of like what our clients are needing. And a lot of that is video and messaging to send out to not only the community and the community that the health system's in, but also the employees and the nurses and the people on the front lines, so they can also get their messages internally over to them since they can't actually be there.
How do you have any tricks that people can use in terms of having to deal with production? I know, like, for example, we have a client that early on in the crisis, we shot basically an ad campaign remotely, meaning we had like somebody, who was on site, kind of from a film production standpoint, walking around with an iPad, showing our creative director and our art director what was being shot. So they were, so they could kind of be there, even though they couldn't be there. Having to shoot different people from the organization in different locations and how they manage that. That's still an issue that we're having to deal with.
Yeah, that's exactly right. I think that that's one example. Actually, a lot of production companies, we're not going out and filming, and we're doing it all just in-house from our homes. And I think one way that health systems can get ahead in any kind of business really is going live, Q&A sessions, behind the scenes, having their own employees posting and sharing, interviews with experts. That's something we've seen, is a lot of CEOs coming forward and sharing messages in video form.
Yeah, that's great.
I think there's just something to say about like it being so, like, I guess, less polished right now, like whether it's CEOs coming across or whether it's, CMOs from a chief medical officer or chief marketing officer, like there is something about it not being so produced that I think kind of creates maybe a realness that we haven't had, whether it's on somebody's phone or on a computer, that I think creates some sort of just a different connection and maybe a kind of rawness to it that we didn't have before. And I think that's pretty beneficial too. So.
Yeah, I love that you mentioned that, because I think that's something moving forward that's going to change, because I think in my mind, I'm always wanting a super polished, like interview looking style video, and we're receiving videos that aren't that way, but we're okay with it. And it's actually producing really well, and we're getting great feedback from it.
Yeah, it's authenticity, which is just so, people just crave authenticity in this situation. I think they would crave it anyway, but also because we're not always getting authenticity from the different places we're receiving information, and that just makes people crave it more. So I think it's just, when people see that, it's kind of like we've been saying with brands from the outset for hospitals and health systems, is making sure that you're not out there promoting yourself. You're not out there talking about yourself. You can talk about your frontline workers, of course, but you need to be authentic and transparent and talking about what's helpful to other people. And I think in a time of crisis, people just, they have to have that.
And I think that also just with video, you're able to, generate more shares because the video message is just like in a shorter amount of time, just delivering so much more information and being able to just kind of strike an emotional chord versus just a CEO. Like I always say, there's a difference between a CEO sitting at his desk talking and being in a hospital in the hallways talking. I mean, that already just changes the scene completely and your feelings. So I think that, if you create the right message, you can truly produce it however you want, whether that's just with your iPhone or a nice camera. So.
Yeah. Okay, perfect. Well, that's a great place to wrap, I think. So Reagan, thank you so much for joining us.
Thank you so much for having me.
Yeah. And Chase, sir, as always.
Absolutely.
I guess we're 1-1 now, though. I didn't keep score last time, so I'm not sure.
We'll keep it going. We're 1-1.
All right. Sounds fair. Let us know if there's something you want us to cover. You can post it in the chat channel before you leave. You can send me an email at cab@thinkrevivehealth.com. Remember to visit our website, thinkrevivehealth.com/COVID-19 for all that content we talked about. Also for a recording of today's episode, a video recording, which will be posted by the end of today. Subscribe to us on iTunes if you don't already. Share this podcast with other people you think it would help, because in the end, that's what this is for. We started this podcast to really provide, a known, consistent resource for all of you in hospital marketing and communications, because you're doing incredible work. It's so important. It's so important to the patients you're helping. It's so important to your organizations overall, and it's so vital to all of us getting through this as we continue to see hospitals and health systems ranked #1 as the place consumers turn to for trusted information. And that means they're turning to you all. So we know it's a tough time for many of you. So just hang in there, keep doing what you're doing. We will be here every day that this crisis is with us. So thank you for joining us today, and we will be back tomorrow. Jeff Spears with us tomorrow. He's going to sit in as the guest host, and we're going to be joined again by Jared Ursi from Revive, who's been on before. Super bright guy. He's going to talk about virtual visits. So come back tomorrow. Thanks for joining us today.